Welcome to Massey College. My name is Nathalie Desrosiers, and I'm the principal of Massey College. It's a great pleasure to welcome you here for this discussion on ethics of vaccination. I want to acknowledge that Massey College is built on Indigenous land, the land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit, and it is the treaty land of the Mississaugas of the Credit. We are very grateful and own this duty of stewardship toward the land, and grateful for the great privilege that we have to continue to do our work here. I am so grateful to Don Gibson and Tom Axworthy for this series on ethics. From the beginning of my principalship, I wanted the junior fellows to know that as they will be leaders in their fields, they owe a certain ethical responsibility to their fellow citizens. And this series is designed to help them understand and reflect on the various ways in which ethics frames our decision. And today, there couldn't be a much more debated and important subject as the vaccination as we make our way out, hopefully, of COVID pandemic. So without further ado, let me pass it to Don Gibson to lead us in this reflection.
Thank you, Natalie. I want to begin by introducing our panel and to really thank them for their willingness to participate here today. First of all, Lois Wilson. Lois is a past moderator of the United Church of Canada, a president of the World Council of Churches, and has been a Canadian senator. Christine Van Geyn, Litigation Director of the Constitution Foundation of Canada and a host of the TV show Canadian Justice. And Tom Axworthy, currently Public Policy Chair at Massey, with a vast experience in both federal and international politics. The theme that we kind of talked about for today was the title, A Pandemic of Ethical Issues. Our panel is going to touch on a number of ethical issues emerging from this pandemic related to vaccines, but not exclusively. But I want to make two short observations. The first one is that the incredible thing about these issues around the pandemic is that just when we think we've exhausted all the possibilities, more just keep popping up. In fact, back in the summer when Tom and I were talking about this series and about this particular session, Tom kept using the word vaccine and let's talk about vaccines. And I kept saying, well, we need to be a little more broad because with everybody getting vaccinated by late October, it may no longer be the key topic. Well, I was really wrong. It just keeps popping up as everybody here in Ontario is trying to get online and get their proof of vaccination and wondering about how we're going to use that, as is happening elsewhere. Just this week in the House of Commons, the question of a vaccine proof and the issue of MPs and privilege. It just keeps coming at us. The second quick observation is that I've not experienced a crisis such as this pandemic that has been so deeply personal. Like you, every day I'm confronted with ethical and moral decisions. Now, I'm a retired minister, but I still work closely with congregations and people. And here are just a few comments that remind us about how deeply personal these decisions are. Comments with conversations I've had. Talking to a senior who was refusing health care because the agency would not assure her that the caregivers coming into her home would be doubly vaccinated. An African minister here in Toronto who said, vaccine hesitancy here in Canada frustrates me when millions of Africans would like to get vaccinated. Someone said, I've got a medical exemption, but when I go somewhere where proof is required, I kind of feel like I'm being judged. Why can't they make people get vaccinated so my wife could get her hip surgery? I have a right as a parent to be assured that all school staff are fully vaccinated. It's not a political thing. I just don't think vaccines are good for me. Surely I get to decide about my own health care. And just finally, what guarantees are there that with a vaccine passport, my privacy is going to be protected? This is a deeply personal, there's lots of big picture issues, and I'm sure the panel will take us to some of those, but it's also very clearly a very personal pandemic of ethical issues. Now, I'm going to ask each of our panelists to comment on ethical issues that they see emerging during this pandemic. And we're going to begin with Lois, please.
Okay, I'll mention a few of them. As you say, there are tons of them. So this list I'm going to suggest is not exhaustive. First one, of course, is the obvious one about refusal to get vaccinated, which sets the individual rights against community rights immediately. Even the one where there's an exemption for religious reasons, I wonder about. When I was a child, we had to get vaccinated for measles, and we had a neighbor who was Christian Science who refused to vaccinate their child. And he used to appear at our door every day saying, you know, is Lois coming out to play? And my mother had to chase him. So that's an ethical issue for me, even, you know, the religious rights against the community rights. That's an obvious one. There's a sub-issue to that, which is the collapse of institutions. The hospital system is in danger of collapsing because of overload and nurses quitting and so on and so forth, and being forced to triage patients, decide who lives, who gets the ventilator and who does not, and critical cases turned away. That's an institutional collapse, and for me, that's an ethical issue. The third one is, what powers are citizens willing to cede to the state or to other institutions? For example, proof of vaccination and so on. We already cede quite a few of our rights. For example, if you're going to drive a car, you have to get a license. You can't, if you're in a crowded theater, you're not allowed to yell fire, fire if there is no fire. So that's kind of obvious, but this is raised in a new way. What rights are we willing to concede to the state or to other institutions? The next one is ethical issues around governments who appear to put political popularity and electability ahead of health concerns. And I won't name the provinces, but I think that's obviously one of the ethical issues. And finally, I think that the COVID crisis has revealed cracks in our social and economic systems, where the poor have been punished and the rich have flourished. The poor get temporary economic help, but it's not permanent. And so that's one of the things that should be discussed. So that's my list, and I'll come back to them afterwards.
Okay.
Oh, one more about, you know, I should have the right to inject whatever, or to say what gets injected into my body. Well, you don't always have that right. We've already seceded it. I mean, when you're being operated upon, do you question the anesthetist of what he's doing to dull the pain? And so that seems to me a kind of a specious argument.
All right, thank you. So now we'll turn it to Christine, please.
Hi, thanks for having me, the right-wing interloper into the Laurentian elite's inner sanctum of Massey College. I really appreciate the invite. My friend Tom, thank you so much for extending it. I want to start by saying, yes, I am on the right side of the political spectrum, but I think it's important to know that these things are sort of put into a political dichotomy that I think shouldn't exist. So I want to start by saying I'm vaccinated. I believe in the science of vaccination. I encourage people to go and get vaccinated. But I think one of the issues on vaccination and around the sort of pressure that people are under if they have some reason not to get vaccinated, I think, you know, I feel the same frustration sometimes that we're still in the middle of this. And sometimes I feel the desire, like I wish people would be more like me. But one of the things that we do in liberal democracies is we try to be accommodating of people who are different from us. And the desire to mistreat people who are different from us is sort of a very primitive and deep felt instinct that liberal modern democracies, with the ethic of tolerance, these societies try to frustrate that desire. They try to temper it. And it's now sort of being given this nod to go ahead and condemn people who are different from you. You know, I have views on vaccination, and I may be frustrated with people who have different views on it, but people are entitled to be different from me. And in a society like Canada, we're tolerant of those differences. So I have a lot of concerns around the way the discourse is operating right now around vaccination in particular. When I hear comments like, I just think it should be made mandatory. People do have a right to consent to their own medical treatment. If you have consented to a surgery, as Lori was talking about, you have consented to the surgery. And you have already given consent, and consent is a core part of medical treatment and the doctor-patient relationship. On the issues of public health and vaccination, there are just a ton of issues. Vaccine passports is one of them. I'll talk about that a little bit at the end of this list I'm going to give you. Another issue, I think, is the right to protest, the right to assemble, which was under a lot of pressure earlier on in the pandemic. We worked on, my organization, we do civil liberties litigation. I worked on a case where a man whose business had been severely impacted by lockdowns went to City Hall alone, wearing a mask, holding a sign, saying something along the lines of "end the extreme lockdowns." And he was given a ticket for protesting by himself in a mask. I have concerns about that. You have a right to protest. He wasn't even assembling, but he would have a right under our Constitution to assemble if he had wanted to. Another ethical concern is empowering the police to enforce laws like that. And I have a lot of concerns about how police operate generally, let alone when they've been given new powers to interact with society at large on things that are not necessarily criminal behavior, right? Like assembling and this man standing alone in a mask holding a sign, that actually wasn't even a violation of the of one of the public health restrictions at the time. And we saw a lot of that at the beginning of the pandemic. And if you're concerned about disparate outcomes, if you're concerned about equality of outcome, you should be concerned about things like that, because rates of vaccination, rates of just needing to interact with police, these things run along racial lines. There's higher vaccine hesitancy in racialized communities, in working class communities, and in lower income communities. So if you're concerned about increasing police interactions with those communities, and if you're concerned about terminating employment for people in lower income or racialized communities, I mean, should be concerned about this. You should be concerned about vaccine passports that have a disparate outcome on minority communities if you care about disparate impact. Another question is around freedom of the press. This is not necessarily related to government, but I've had some really interesting experiences in interviews with the press where media have declined to run stories that even highlight adverse outcomes from vaccination, which I will say, I'm vaccinated, I believe in vaccination, but as a person who believes in that, I have to acknowledge that there are rare adverse reactions. And I've encountered situations where the media will not run stories that highlight adverse reactions because they have expressly told me that they want to encourage vaccination. And that is not the role of the media, right? The role of the media is to tell stories, to bring attention to facts, not to create a particular narrative, even if it is a good narrative, which I think vaccination is a good narrative. But I think you're not going to encourage more vaccine uptake by pretending that adverse reactions don't happen. On the bioethics issue, I'll just touch really briefly on that. Lois, I think, mentioned it briefly about how to deal with overwhelmed ICUs. I've actually done a program of my television show, Canadian Justice, about that exact issue. So triage is not new. Triage has happened in the history of hospitals. There have always been triage, and you pick the patient who will have the greatest likelihood of survival on whatever timeline's been selected. But one of the things that happened in Ontario that there wasn't a lot of attention that was drawn to was there was a proposal for a period to suspend consent for withdrawal of life support. So right now, if you're going to withdraw someone from life support, you need family consent to withdraw them from life support. There was a group who was advocating to withdraw that consent so that the physicians and the hospitals could have their own system to decide whether a person would be taken off life support or not. And I think that that is a very concerning thing for communities with disabilities in particular, and vulnerable people, especially since rates of ICU use among COVID patients run along lines of vulnerability, including disability and age. So the last thing I wanted to mention is vaccine passports. I'm working on a case involving vaccine passports, particularly in British Columbia, and the way we're working on it relates to medical exemptions. The British Columbia government has expressly said that they will not accommodate religious or medical exemptions. I'm more concerned about the medical exemptions than the religious ones, but the fact that the government will not accommodate them is a clear violation of your charter protected right not to be discriminated against on the basis of disability, because people who can't be vaccinated for a medical reason are living with a disability. And even if we want to, that's just wrong, right? Like we're in a society where you need to accommodate people who have disabilities. And from a rule of law perspective, it's also concerning, right? Even if you want to say that legal positivism or is a moral or ethical system, this Bentham notion of legal positivism, that there are no natural moral laws and right and wrong is merely commands of human beings. Even then, vaccine passports without medical exemptions are inconsistent with our pre-existing legal order and rules of established laws, namely human rights legislation and the Constitution. So our laws are supposed to be knowable and predictable. If suddenly the government can create legislation where they will not accommodate medical exemptions for people who can't be vaccinated, that's extremely, extremely concerning. So I hope I didn't speak too long, but those are some of my top level concerns.
Thank you, Christine. On to Tom.
Well, thank you, and I want to begin on the list, Don, that you raised and Lois raised, and then get to one of the points that Christine emphasized in her talk, and that is, many people have talked to me about their charter rights in terms of the vaccination debate. And my starting point is to remind them and to remind all Canadians, and Lois touched on this, that with the Charter of Rights and Freedoms in Section 1, it begins by guaranteeing the rights and freedoms of Canadians, but subject to reasonable limits that can be demonstrably justified. That is, right at the start, when the charter was designed, the drafters knew that rights weren't absolute, that there are equality rights and liberty rights and religious rights and association rights, and that these rights contend. So a society has to, and courts and politicians, parliaments, have to decide how to deal with this contending issue when rights collide. And we're certainly seeing that in this pandemic debate. But I would argue that with the rights enunciated in the Charter, reasonable limits for those who say they have an absolute right, reasonable limits surely would include a pandemic that affects the health of millions. And demonstrably justified should mean the data that we acquire from science and experiments that show why those personal freedoms must be possibly infringed for the common good. So the drafters of the charter began very cognizant of the exact issues that we're discussing today and the huge debate we've had about the pandemic, but they put a formula of reasonable limit, demonstrably justified. And I always try to remind people, can we apply that criteria to the pandemic debate? And if we do, I think it certainly leans toward the side of the protection of public safety. Now, not necessarily in every case, in every instance. We've just talked about medical exemptions and so on. But by and large, there is a very strong case that can be justified by Section 1 of the Charter for the wide-ranging measures that governments have brought down in terms of protection of public health during this pandemic. The second point that I wanted to make, and this directly goes to Christine's, I think, very valuable, useful opening point, that we do have to have a debate, and we have to try to have civility, and we have to try to respect others' opinions in this debate, because it's not easy and emotions can get very high. We are talking about life and death. But I want to look at who are the non-vaccinated. I mean, we talked about trying to persuade the non-vaccinated to get vaccinated. The goal is about a 90% level of Canadians. So who are those who are hesitant or refusing to be vaccinated? And is there a way to perhaps persuade rather than impel? Okay, so we're aided in this, and it presents an image, I think, very different from the one that many hold, which is that the anti-vaxxers are wild Neanderthals, throwing rocks at Justin Trudeau and so on, all followers of Max Bernier. There are Canadians like that, obviously, but in fact, it's a much more nuanced view of the non-vaccinated. Abacus polling firm did a huge survey, over 30,000 respondents. That's enormous, on this very issue in the late summer. And they found very interesting findings, which is that the non-vaccinated were about 14% of their sample. That's quite large at this time. This was mid-August. Is about 4 million Canadians. That's a very substantial number. But within that 4 million, they're divided into two pretty distinct camps. The first would be what we would call the hesitant, which is that they had real concerns about the vaccinations, some of which Christine raised in terms of what is being put in their bodies, but they weren't diehard on it, which is that a significant portion of the non-vaccinated were people that we will call naturopaths, people who don't believe in prescriptions generally, who want natural treatments, who worry about the vaccine, but worry about other kinds of injections as well. And among the hesitant, for example, quite a large number, 45%, nearly 50%, their hesitancy was to the hesitancy of having needles. And that's not unknown. If I remember in my grade schools, when we had to get vaccinated for measles and so on, Lois mentioned that, there was a good significant number who were afraid of needles. That's a real fear with many people. We shouldn't make light of that or make fun of that. And a significant number of the hesitants even voted for the Green Party or voted for the Liberal Party. I guess the image I'm trying to put to you is that this is not a solid right-wing bloc. These are people who've got all kinds of issues and are open to persuasion. That 65% or so say that if their friends or their doctors or people they trust could persuade them that they would in fact get vaccinated. Now, The worst thing you can do for the hesitant folks is what Christine said. If we insult them and say these are ignorant people, or you're killing me, and berate them, that's exactly when they get their backs up. So if we're going to hit that 90%, understand that there's about 7% who are open to persuasion, but it takes some skill, and insults are not part of it. And some of their response has to do with a natural way to achieve health as opposed to the way of science. Now, there's another 7% who I would call are very hardline. They will be very hard to persuade. They don't trust government. They trust very few people. They are much harder in their opinions, but one could still vaccinate 90% of the country, even if we couldn't persuade that 7%. So those of us engaging in this debate, remember, those who are unvaccinated are not a monolith. There are many strands of opinion, and at least half of them are open to persuasion, and at least half of them are neighbors who tend their gardens and worry about natural health remedies, and vote liberal and green.
Thank you, Tom. I'm just going to ask each of you very, very briefly, for the sake of time, just if there's anything you wanted to clarify about what you said, or anything you want to quickly comment about what others said. And Lois, I'll start with you.
Yeah, I'd just like to say, I get the point that there's pressure for people to get vaccinated. And I agree with Tom that we need to ask, why. Some people have very valid reasons, and there need to be conversations rather than something mandatory laid on, because all that does is make for camps which will oppose each other no matter what, and they're not listening to each other. So I think that we need to listen to why people don't want to get vaccinated, and there are many, many reasons, and that takes a lot of time, but it needs to happen. So I thought that should be emphasized, that we listen to each other so that we don't drive the wedge in society even deeper by laying on mandatory things, and you do this or else, with no discussion. Not a good idea.
Thank you. Christine.
Yeah, 2 points. I want to reiterate what everyone has said, that we should treat people who we disagree with grace and compassion. And a lot of the people who I've spoken to who are not vaccinated are very educated about vaccines, probably more educated than the general public. They come from all walks of life, and a lot of them are afraid, right? Like, a lot of people have been boxed in society. We're in a place right now where if you are not vaccinated, you can't even leave Canada, right? Like, with the new policies coming in that require you to have a vaccine to get on an airplane or to enter the United States. If you, for some reason, are not vaccinated and you are committed to that decision, that's a frightening place to be. My second, I want to respond to Tom's comment on Section 1 of the Charter, which I've been working with in a lot of cases that we've been doing at the Canadian Constitution Foundation. Almost every one of these cases comes down to Section 1 of the Charter, where you need to prove a number of things. One of which is that the policy is minimally impairing, another is that it's rationally connected, and the other is that it's proportionate. So I think when it comes to vaccine passports in particular, I'm not convinced that general vaccine passports would pass that test. Just because with high rates of vaccination, the onus is on the government to prove that this policy is actually going to reduce transmission. And many, many, many levels of government, BC in particular, has explicitly said that vaccine passports are about incentivizing vaccination, not about reducing transmission. They have said that. That is the government's, they have made that position clear. And when it comes especially to the lack of medical exemptions in British Columbia, which is the case we're working on right now, of course, it's not minimally impairing, because British Columbia is really the only province that's not granting them. if other provinces can grant medical exemptions for people who have developed pericarditis after their first dose of the vaccine, by the way, which is cruel, unreasonably cruel to people to punish disabled people who went out and tried to get vaccinated and now can't. I mean, what on earth is the justification for that? What risk is a teenager with heart inflammation posing when she enters, a movie theater with her friends who she's already been isolated from for the last 2 years? So, Section 1 comes down lots of different ways, but I think in the cases that we're picking at the Canadian Constitution Foundation, I'm confident it will come down on our side.
Okay, thank you. Tom.
Well, I emphasized in my original, in my first submission, about the rights and empathy with those who are non-vaccinated. We've just had a little discussion about Section 1, but I want to bring up a second dimension, which is very broad, but certainly applies on this vaccination debate, and that is that our society doesn't just run on rights. Along with every right, there's also a set of responsibilities. There's a set of duties of being a citizen. You have to give back as well as demand for. And on the question of vaccines, and when you make that personal decision to reject them, you should be thinking as well about your responsibility to other citizens. I live in Winnipeg, Manitoba now, and just yesterday in the Free Press, there was yet another horror story about a man who had, for the 10th time, his operation for a severe problem had been delayed because the nurses and the doctors and the emerge people all had to convene on the dealing with the vaccination, those unvaccinated, particularly in southern Manitoba. So this man was in pain and had been waiting for months, despairing. Now, we can replicate that story over and over and over again. My bet would be there are now. We already had a problem of wait times before COVID, but we now have made that just an existential problem by jamming up the emerged systems because of those who are unvaccinated. The public health officer in Saskatchewan yesterday, having to deal with, broke down and cried out of the frustration of the unvaccinated filling the hospitals, young people dying when they could have been saved, and also jamming up the whole system. So there is also, if we have to be tolerant and respectful of those who hold differing opinions about vaccination, we also should not be afraid to say there are wider responsibilities than your individual preference, and your choices are potentially threatening the healthcare system. And if you do that, you are then threatening the future prospects of millions.
Okay, thank you. I want to just shift gears for a minute or two and just a second round, a little shorter than the first one, and that is to invite you to be a little bit prophetic and just to wonder, reflect on what of these emerging ethical issues around the pandemic, what are we going to be dealing with in terms of those issues beyond this pandemic? What's going to have legs and keep running with us in terms of our society into the future? So Lois, I'll come back to you.
Well, I can think of a few. One is the massive loss of confidence in major institutions in the country, a defiance of formal societal acceptance of authentic information from the healthcare system, from the mainstream media, from institutions, from governments. I mean, so it's a shift in who do you trust, but a massive rejection of information from institutions which have built our consensus as a society. The second is that there's a divide between citizens versus citizens, and that's likely to continue unless we really address the situation. There's divided families, long-term hurt. And I'm not sure who's going to address that, but it's happening. And that's there. The third one is, and I've long-term revealed the cracks in our social and economic system. And I mentioned this before. It's punished the poor and it's given temporary help economically, but there's no suggestion that we should look at the situation. We simply want to return to normal, and I would hope that because every crisis is an opportunity, that we don't return to normal, that we look at our society and begin to heal some of those cracks. But in short, I think that what's happening is somewhat a threat to our democratic system and to our consensus as a society as to what's important and how we manage it, and what kind of powers are we willing to cede to elected officials and to other institutions. I don't know whether it's Trump come north or what, but I sense that that's happening in our society, and I find it very worrisome.
Thank you. Christine.
Yeah, so I think we should be concerned long term about the cleavages in society and the way discourse has developed, where I feel like this is one of the most polarized times in the world in terms of politics. It's an extremely polarized period. And I don't see that getting better. On civil liberties, I have a lot of concerns that there's sort of this boiling frogs situation, that our civil liberties have been eroded, and some of those erosions could be permanent. You know, after 9/11, we all started, I guess it wasn't 9/11, it was the shoe bomber or whatever, but we all still take our shoes off at the airport. And are we going to become more tolerant of intrusions into our fundamental freedoms in the future in ways that aren't meaningful? Third, I think that this situation with this pandemic should be seen as an indictment of our healthcare system generally in Canada, that our healthcare system is inadequate. The fact that the system in Saskatchewan is overwhelmed right now with, I think, 72 people in ICUs. We should be concerned that they're overwhelmed if there are 72 people in ICU. Like that is insufficient capacity. We have a problem with rationed care in this system, and however we solve that problem, there needs to be a conversation about alternate ways of funding healthcare or increasing funding to healthcare. But I obviously have a preference of finding alternate funding models for the system that we have. The last thing is not to harp on the medical exemption thing, but in British Columbia, in order to, you really can't get a medical exemption. They're really not available. But if you want to attempt to get one, you can have a specialist write a letter for you, and it is then subject to public health approval. And I think that the notion that the government can insert itself into the patient-physician relationship should be concerning for everyone. Right now, it should be concerning, but for the future, it should be concerning as well, especially when there's a government monopoly on healthcare. In what other situations in the future would we tolerate the government saying and inserting itself between the patient and the physician saying, no, we know the best interests of the patient? That relationship is supposed to be sacrosanct. And right now, we're tolerating state intrusion into it.
Okay, thank you. Tom.
2 points. One on a critical issue that COVID has highlighted so tragically, but that our country is very behind in contemplating, and that is long-term care homes and a variety of options for a rapidly aging society. There had been studies and reports about long-term care homes, and in general, how can the aging baby boomers, I'm one, still lead fulfilling lives going forward and not put undue or tremendous burdens on the state and the current generation of workers and citizens. And boy, COVID has showed everywhere that the long-term care issue is huge. We need a going forward, a real look at home care, at different kinds of arrangements for seniors with medical help in their buildings, graduated up. There's just the deaths and the deprivation of people left to themselves when relatives couldn't even visit. It just made you want to cry almost continually. And like so many things, we had been warned about this coming, and it took a crisis to bring it so clearly. And it's a complicated issue. It's a health issue. It's a housing issue. It's a social welfare issue. It's a family issue. When I grew up, my grandmother lived with us, and we loved that. It was good for us, and I think it was good for her. Is there a way of encouraging that we can encourage families to do that? That ethic of family staying together has diminished, certainly from my youth. Anyway, that is just a huge issue going forward because there are so many elderly boomers. The second, and both Lois and Christine alluded to this, and that is the issue of trust, polarization. Societies can't run without trust. I mean, we can't all get what we want, and but we have to agree to the rules of the game aren't fixed for any one region or any one group of people in order for us to keep playing that game of being a citizen and being a self-governing men and women. Well, trust has been really frayed in COVID. When we look again at the unvaccinated, their trust levels in governments or elites is very small, including what I would call the unvaccinated moderates. The trust issue is huge, and to go forward, to have a country where one party essentially represents our cities, another represents smaller communities and rural areas, very little crossover between the two. That's a very, very dangerous situation. We cannot allow the extreme polarization to occur in Canada, where any one part of the country says, I'm excluded from the game, because that then leads to withdrawal or extremism. And we have to stop that from occurring.
Okay, thank you. I'm going to just turn to some questions, and there's quite a lengthy conversation going on in the comment box. And so I'm going to kind of cherry pick the first question, which is, I think, hopefully kind of a collection of some of the conversations going on. And that is to pose that question, jab or job, how we feel about that kind of a question. Right now in Ontario, we're wondering about whether all of our healthcare people need to have a jab or might lose their job. So, I think that catches some of the conversations going on. And so, Lois, how do you feel about the jab or you lose your job question?
Well, I happen to live in a retirement home, and I was interested in Tom's comments. Mine is privatized, but it's nonprofit, and it operates at half the price of many of those syndicated long-term care homes we have across Canada. So I think there are various models of care for seniors, and I think seniors should be consulted and not somebody else decide for us how we're going to live. That's my first point. The jab or job, I was delighted that in our retirement home, all the staff are required to be vaccinated, and the people that come in, personal care workers and even cleaning ladies come in, but they have to be vaccinated or they're not allowed in. And I mean, I fully support that, because the last thing we want is to get the COVID caught with 400 residents who live here and it'll spread like wildfire. So in my own situation, I certainly support that. Philosophically, I support it.
Okay, thank you. Christine.
So in my role, we work on constitutional issues. We don't work on employer mandates. So if an employer mandates vaccination, that's that doesn't involve the government, right? My concerns usually relate to the government. From a policy point of view, I think that I'm generally supportive of management rights to impose conditions on their employees, conditions of employment. But I also think that it should be dependent on the job. I'm not an employment law expert, so I think there's probably criteria in employment law. I know there's criteria in employment law about what would constitute a reasonable condition of employment. I think it's reasonable to require employees at long-term care homes to be vaccinated. I think it's reasonable to require people who work in hospitals to be vaccinated. I don't think that it's reasonable or necessarily justified as a condition of employment that a person who's on work from home be vaccinated. I don't see what the workplace safety rationale for that would be if there's no return to work plan. But again, I'm not an employment lawyer, so I don't have expertise on that specifically. I also have policy concerns as it relates to what happens if there's a staff shortage, right? So when hospitals are imposing these vaccine mandates, which I think that they probably are entitled to do as employers, if that results in a shortage of nurses, what's the policy solution there? And is it worth losing enough nurses if you already had a nursing shortage, for example, in provinces like Nova Scotia? Can they afford to lose that many nurses? Or might it be a better policy option to have unvaccinated nurses deployed differently to be facing patients who might not be as vulnerable to COVID? As I said, again, I'm not an employment lawyer. These are just sort of policy questions that I have. I do think employers mostly have a right if in those job specific contexts, but they need to consider the consequences.
Okay, thank you. Tom.
Well, as Christine said, I think it depends very much on the job. The job, if you are meeting, if you're in healthcare facilities, that's a perfectly reasonable request of the employer. Does your individual action put at risk the clients and those you're supposed to be serving? So in many places, it just makes eminent sense, and employers have the right to ask. But I would add that we should add a codicil to that rather than jab or job. I would also add then, or rapid test. That is that if you have employees who've got genuine concerns about vaccination, but are willing to regularly be tested to show that they don't have the disease, that is to me a valid option to also bring into to give some choice. That you don't have to get vaccinated, you can keep your job, but you have to be regularly tested so that you're not putting the health of your coworkers at risk.
Okay, thank you. I'm going to actually bring us back to something that at least a couple of you touched on earlier, and I'm trying to kind of capture some of the comments. And clearly in a number of the comments, the question that seems to come up often is this question about trust. Can we trust, or do we have a lack of trust of our institutions, of our healthcare professionals, of the so-called science, some people might say, around vaccine? So I think it would be maybe reading the comments and listening to what you've said might be helpful for the last part to hear each of you a little bit more on that whole question of trust, because you're right, we sense we're losing a trust. So let's maybe broaden that little conversation a little bit more. Lois, any comments about this concern around trust of institutions and structures and healthcare?
Well, yeah, I mentioned it, and I think it's a long-term result of what we've been talking about, and it's going to be with us for quite a long time. I mean, it's divided people, so there's mistrust, certainly mistrust of the mainstream media, certainly mistrust of health providers, a lot of mistrust of government. I mean, a lot of mistrust of institutions where there used to be some general consensus, although there was almost official opposition, which was welcome. But that model doesn't seem to be holding up. And I find it extremely troublesome for the future of democracy. I think it's linked to the internet, the social media,
Mhm.
new phenomena which wasn't with us when many of those institutions were brought into being.
Okay, Christine.
Yeah, I think that there have been a bunch of institutions that have done a lot of damage to themselves and caused a lot of the erosion of trust in them among the public. So throughout the pandemic, first we saw at the beginning of the pandemic, our health leaders were telling us not to wear masks. And they were. I know why. We all know why. It's because there was a PPE shortage. And they wanted PPE to be available for frontline healthcare workers. We all knew that we were being lied to. It was shocking that our leaders were lying to us this way for a lot of people. I mean, maybe not so shocking for some, but I think a lot of people saw that, and it simply has continued. The failure of the government to report or disclose comorbidities in COVID deaths, I think, has led to a lot of mistrust. The mislabeling of certain COVID deaths, which the government has apologized for when it has happened, when it has been identified, though. So it leads a lot of questions of how often are these misidentifications happening? The case I'm thinking of in particular was one in Alberta where a 14-year-old was reported as a COVID death. And that was upsetting for a lot of people, right? Because one of the blessings of the pandemic has been the relative low rates of death among children, healthy children. So the reporting of a death of a 14-year-old child is frightening for a lot of parents. I'm a parent, and that scared me. It scared a lot of people. And we know that there's a push to have children vaccinated if they're over 12, and there's going to be a push when the vaccine's approved for the 5 to 11 group. So the reporting of this 14-year-old was frightening for a lot of people. We know it's probably being used as a narrative to incentivize parents to vaccinate their children. It turned out that this 14-year-old had stage 4 brain cancer and died from brain cancer. 2 days before he died, he was tested for COVID, and the test was revealed to be positive. And this is all reported in the mainstream media, and the government has subsequently apologized for the misreporting of this death. But it leads to a lot of mistrust among people who are already asking a lot of questions about, especially with respect to childhood vaccination, if it's going to be necessary. I mean, it's pretty bad. These are own goals, right? These are government own goals.
Mm-hmm.
Okay, Tom, thank you.
Well, I think that around this issue, there perhaps I'm just reiterating the points of my colleagues, but this is another whole topic that we could have a session on,
Yeah.
and that is the particular role of social media in spreading disinformation, and sometimes outright lies. That we have an epidemic of viruses medically. We have an epidemic of misinformation, and the whole world is trying to grapple with the power of the Facebooks and these relatively few platforms that can be used, can be manipulated sometimes by foreign powers who like spreading discord and misinformation among democratic countries. We can't be blind if we're trying to deal with trust that there's daily poison put into our system through social media, and how to regulate that, how to prevent it, how to make these private institutions adopt better standards, how to enforce those standards. If they don't do it, how to deal with this huge new power centers in our societies is another enormous issue that we could talk about post-COVID. How do we deal with the powers of social media in such relatively few institutions being so open to those who spread misinformation, either inadvertently, deliberately, or in the case of foreign powers, trying to undermine our democracy. The second point then is a much larger one. How do you begin to build trust? And we certainly know, I just talked about it among the unvaccinated, that the levels of untrust of virtually every institution are so large that this is a real problem. So one way that I have always found to gradually build trust is to bring people into the decision making. Let them feel that the process has fairly considered their point of view and that it's not biased against them, whether you're running a small organization or a large one. And so without jumping from the question of trust to one of the issues that I think is important, which is the role of members of parliament and parliament itself, this may be a leap for some, but if we have a system now where the executive basically runs almost all parliamentary institutions, where MPs don't even elect their own caucus chair, where the committee systems, Lois was the senator for many years, where our committees used to do great multi-partisan work. That is, the political theater was left for question period and the House of Commons itself. The real nitty-gritty work, where you took a variety of views, was done in the committee systems. When we mentioned the charter, for example, Pierre Trudeau, of course, has given so much of that credit for initiating the idea, but people forget how many amendments were proposed by the Progressive Conservatives and the NDP, which were accepted in committee. The charter was rewritten in committee by all the parties, and it's a much better charter for that result. But we have that increasingly less and less the case in our parliament. It is the my way or the highway, says the executive, and the MP say, yes, sir. Well, that's got to change. And if we can start with those basic institutions of government, parliament, giving the MPs who come from all regions more of a role, then gradually that engagement might begin to start. But if people think parliament is fixed against them and the government runs it without listening to them, that's where mistrust really breeds.
Okay, I'm going to give each of you literally 1 minute. If there's any last thing you want to hit upon or comment upon. So, Lois.
Yeah, I just wanted to say, we're used to political parties giving out promises and then not delivering. So, when politicians give speeches, you have tongue in cheek. We know that. Up to this point, we thought that science was a fixed thing, but it isn't. And I think it's up to the scientific community to now educate the public about the changing scene about science, because it's not one thing. So they, of course, didn't recommend masks at first because they didn't know what was going on. And we expected them to have a fixed position, which is not scientific. So I just mentioned that it's an issue to them to please educate us.
Thank you. Christine.
My closing comment is, if you have questions about the vaccine, book an appointment with your doctor and go and spend some time talking to your primary care physician about your individual risks and your situation. Don't listen to me. I'm not a doctor. Don't listen to anyone online. Go and talk to your own primary care physician. They know your individual medical needs the best, and they'll be able to give you the best advice.
And Tom.
Well, I think Christine's given excellent advice to consult your physician, and in that consultation, you can consider your rights, but also think about your responsibilities.
Okay. Well, I want to thank all three of you. It's one of those tip of the iceberg kind of conversations, right? I mean, it's just so much, and I'm intrigued by just the surfacing of that whole question of trust. As you said, Tom, another kind of topic for the future. But I really want to thank you for taking the time and for sharing openly and honestly your opinions, and we really appreciate that. So thank you very much.
Thank you.
Bye-bye.